What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast.
Good morning, everyone. This is Dr. Zach Baker with Rehab to Perform and R2P Academy, and welcome back to our podcast. If you've been listening in the past, you are probably familiar with my voice. You're probably familiar with Dr. Josh Funk, our two residents, Christian and Bami. But we have a new guest on today, and somebody that we have recently brought onto our staff within the last calendar year. We've got our nutritionist, Jess Murgeytio, with us. And Jess, welcome. If you don't mind spending a little bit of time just telling our listeners kind of a little bit about yourself, your background, and really how you got into nutrition.
Thank you, Dr. Zach. I'm excited to be here. And the first 6 months of my time here with R2P has been awesome. So I'm really, really glad that you guys brought me on. Very grateful. A little bit about myself. I was born and raised in Florida and ended up doing both degrees there at Florida State University. So my undergrad is in clinical nutrition. And then in graduate school, it's science of nutrition, but you got to choose an emphasis area. And luckily, my emphasis area was in sports nutrition. So we had an awesome staff of professors there that worked directly with a lot of the athletics on campus at Florida State. So I was able to kind of emphasize my graduate work there, which was really cool. I remember I actually went into my bachelor's degree as nursing. And I think it was my freshman spring, I took Intro to Nutrition, Science of Nutrition. It's very popular because it's a non-lab science. And within 2 weeks, I went and changed my major to nutrition and never looked back. The science and metabolism really just hooked me, and learning how the body works at a deeper level, learning how it works with all of our macro, micronutrients, and then bringing in clinical aspects and sports aspects. I never looked back, never have regretted it. I love being a dietitian. It's definitely who I am to the core. I think it brings in something that I love, which is education. And you really can't be a dietitian without wanting to educate people. So I absolutely love it. My work prior to R2P was very clinically heavy. I did a lot of my internship, and my first job was really in more ICU. I went and worked at Crestview, which is a long-term intensive rehab in Atlanta, and did I worked with a lot of AIDS patients, a lot of burn patients, and then came up here and started private practice. Probably, went to Lifetime Athletic first and got to really start dipping my toe in working one-on-one with actual patients that want to be more on the optimal side of things. And then went to Bethesda Medical Associates, did a lot of clinical work, and, then luckily got to come on staff with you guys. So here we are.
That's awesome. And that seems that I didn't actually know that you were originally going down the nursing route. So that's pretty interesting. Yeah. And I can see the appeal of the non-lab oriented science classes in undergrad as well. I remember being loaded up with physics and chems and bios and organic chems, and they are brutal. But it sounds like your career progression is honestly very similar to a lot of us in the PT field, who you get out of PT school, you kind of land that first job, you get into in our setting, it tends to be oftentimes the availability of jobs tend to be in your more general, traditional outpatient practices where you see a little bit of everything. And it's great. It gives you a lot of reps. It gets you exposure to a variety of patient populations. And it lets you really get your feet underneath of you in regards to all of this stuff that we learned theoretically. How does it actually play out? How does it play out in regards to, does it match what a textbook says it's going to? Does a patient actually do what we are hoping they are going to do? And kind of learning how to navigate those early career marks. And then as you start to get a little bit more confident, you start to get a little bit more comfortable, you start to learn really where your true strengths and passions lie. Then you get a little bit more nuanced and a little bit more niche. You have been with us really right around kind of the last holiday season. What was, I guess, unique about the opportunity here, or what were you hoping that coming over to R2P was going to allow you to do with your career, either just from a personal or professional standpoint?
Sure. I love working with patients one-on-one. So the ability to continue that here with R2P was extremely appealing. But for myself, I have never really built out a program before. And that was one of the biggest appeals, was to come into a company that was so well established, very well regarded in physical therapy, and then actually having to kind of build on a new branch that we knew would benefit patients. Because one of the best things about this opportunity is that physical therapy and nutrition really do go hand in hand. And we know that nutrition is extremely beneficial for patients in all aspects of rehab. But then from almost more of a business side, which I've never really touched before, being able to see from the ground up, how is something like this built? So I have learned so much in 6 months from a very different aspect, but then also staying with my core of counseling clients and working with them. The other really interesting aspect of being kind of in this avenue is to work with very motivated clients. Not to say that my patients before weren't motivated, but this is almost like a very different patient population. I'm getting back to athletes and really young athletes, which has been extremely enjoyable for me to work with people that are just, I got a lot more middle-age chronic disease at my previous practice, and that is really where a lot of my clinical strengths lie. But being able to brush up on athletes' nutrition and kind of re-engaging with a younger population was something that was really appealing, and it's been really fun to do.
Yeah, and for those who are unfamiliar, we have been established as a PT company for, right around 9 years at this point, 8 or 9 years, but we never had a nutritional branch or a nutritional wing of the company. So Josh and Jess have worked hand in hand together to really build this out. For Jess, she's fortunate enough to walk into a company that does have, already an active patient base. We have some things from an infrastructure standpoint, from a business standpoint, but I would be lying to you if I said we had any semblance of what a nutritional program looked like coming into it. So she's done a tremendous job in her first really year with us in regards to not only just taking good quality care of patients, but also making sure that we're building something that is going to serve her well and just move forward in the ability to grow with the company also. And Jess, you had mentioned that, nutrition and PT and really nutrition and healthcare are, I don't want to say synonymous, but they go hand in hand. And for the large majority of our listeners, they tend to be physical therapists, strength conditioning professionals, athletic trainers. So would you mind touching a little bit on, for me personally, as a physical therapist, I take nutritional courses. We have we get it on a very superficial level in PT school with some of the certifications that I've taken, with our sports board certification, going through CSCS in the past. They touch on it so that there is an appreciation that there is a connection, there is an influence. But as with all things, there's levels and there's layers to this stuff. And I can say that, I may know the ingredients, but I don't really know how to put that recipe together. For those who are listening, could you touch on a little bit in regards to how does nutrition, we know that it affects our patients and their plan of care. What should we as clinicians be on the lookout for when we're working with a patient that may clue us into, hey, this patient, it would really serve them well to talk to a dietitian or to talk to somebody who can really break this down and give them a more either individualized approach or just a more comprehensive educational experience?
Sure. No, that is definitely something I wanted to make well known, is that while nutrition is for everyone, we definitely want to start familiarizing ourselves with when I'm speaking with my physical therapist here on staff with what are some red flags to look for to trigger this referral. One of the biggest ones that, and I've gotten a lot of this from the physical therapists on staff, is delayed healing or reoccurrent injuries. I was very ignorant to how frequent things like stress fractures were in young athletes, and I've gotten a chance to speak with a lot of these young athletes who are having reoccurrent stress fractures, and so that's one. Or delayed healing, especially delayed healing with soft tissue repair. Even things like ACL. you start looking. I had one patient specifically that come see me recently who was having a nagging shoulder injury, and his PT was really struggling with, why is this not progressing? And when we sat down and looked at his diet, he was eating on average between 800 and 1,300 calories a day as a mid-40s man. And this was obviously extremely insufficient. And so being able to speak with him on getting his calories up, getting his protein up, and he's actually started to see some improvements in his progress with his PT. So I would definitely look at reoccurrent injuries, especially in youth athletes. That is something very, very common that I've seen here. And then any type of delayed healing. Another thing to be on the lookout for, and this is as you kind of build your rapport with your clients over your sessions, there's nothing wrong with bringing up nutrition and just talking to them so you can understand kind of how they're eating. And in that process, if you hear any type of restrictions with diet, like strict intermittent fasting approaches, especially during rehab, or vegan diets, making sure that you can kind of test the waters and see, is this somebody who's just gone vegan and maybe they really don't understand how to get their protein in? Or is this somebody who is worried about weight gain post-recovery? I've had a lot of that. I need a whole new knee replacement. Now I'm worried about gaining weight in this process, so I'm going to go on this really strict intermittent fasting protocol. I've had a few of those. So those are another ones to look at, any type of restriction around diet. And then the third one that I would just want to mention would be any type of female athlete triad. So looking at those endurance runners that are female or endurance athletes that are female, very low body weight. That also gets into some weight-based sports like gymnastics and dance, and just making sure that you even just kind of test the waters there. Is this something that their parents may be aware of? You can even speak to the parents if there's been any concerns of restricted eating. I think those are probably the biggest three that I've been seeing with some frequency since I've been on staff with you guys.
And I can personally attest to being a PT for patients who have had all three of those presentations at some point. I've worked with individuals who have had delayed healing, recurrent injuries, repeated stress fractures. I've worked with people who have had drastic modifications to their diet, either under a informed or underinformed standpoint. And then I've also worked with athletes, honestly, of various ages with female athlete triad as well. And I think from a clinical standpoint, something to keep in mind is, like you had mentioned, it's information gathering. And our first patient encounter, the actual X's and O's of PT, and I don't want to dumb it down, but it's relatively simple. Like, we look at range of motion, we look at strength, we look at things that are very, very easy to quantify. And then when you can identify something as an impairment or as a deficit, it's a pretty direct correlation to what activity should help with that deficit. Hey, you don't have great knee flexion. All right, well, I know like 15 different knee flexion exercises. You don't have great overhead strength. All right, well, that's pretty easy. We can pick from one of these overhead strength exercises. What we never know is how they're going to respond to that. And I think you kind of hit the nail on the head earlier when you said, like, when you identify these things, you don't just jump right into them and immediately steer the conversation that way, unless there's a red flag or something that would warrant that. But it is something that you have to be mindful as you're working through a plan of care with a patient. If they are not responding in the manner that you think they should be responding, that's where a lot of these conversations should start coming back up again. Hey, you had mentioned you made this change in your diet. You had mentioned that this is your second or your third time you've dealt with this injury. We're doing stretches that should, in theory, help with your mobility, and it's not helping. We're doing activities that should help with your strength, and it's not helping. Why is it not helping? And this is where you go into really like the non-sexy conversations of, are you sleeping well? Are you eating well? And I think that's where that first interaction with the patient, it can be very difficult to directly link what is the main cause or the main influence for their injury or for their lack of progress. But as you're working through a plan of care and you're going through your stuff that should work and it's just not working or not working to the degree or at the rate you'd expect it to, personally, that's when this information really starts to kind of hit me in the face, and it makes me want to think, I need to ask some more questions, or I need to start steering this individual into the direction of somebody who has experience with this. And I think with a lot of these conversations, He talked about, delayed healing, recurrent injuries. Oftentimes, we can't stretch and strengthen our way out of those things. Oftentimes, it does come down to recovery. It does just come down to having a very good, consistent routine. Unfortunately, that doesn't mean a lot coming from my mouth oftentimes. And I can tell people what they should be doing from a dietary standpoint, just on a macro level. But I think having that coming from a professional in that field, it's no different than when an individual comes in and they have low back pain or they have knee pain, and I give them all of the exercises that they've already looked up online and are aware that are there. They just do not have the full-fledged confidence to commit to it because they don't know if it's safe to do, they don't know if it's appropriate to do, they don't know the most efficient way. And that's really where I think that integration of nutrition and the dietary talks come into play with the patient population, is having somebody on staff and having somebody readily available who can kind of cut through the weeds for them and say, yes, this is what you should be doing. And we're not reinventing the wheel, but I'm going to give you the game plan. I'm going to hold you accountable, and I'm going to make sure that we are tracking the things that are meaningful, and we're going to navigate this as best as we can. Going further down that route of nutrition, a common conversation that I find myself having, or just questions that I'm constantly fielding that, again, I can initiate the conversation, but I find myself limited in the amount of depth that I can go with, is supplements. And I know this is a conversation, whether it's your youth and your high school athlete that's looking for, every supplement in the world to make them bigger, faster, stronger, look better. Or it might be your adult population that they could have either a generic or a more unique or individualized health concern that they're looking for that right supplement to help put them in a more optimal standpoint. But before we really get into the weeds with this, can you just give us your personal thoughts, just from your educational and clinical experience of our supplement? One, can you define a supplement? And then two, is it necessary in a diet, or where do you find the most value incorporating supplements into a diet?
Absolutely. And one quick note before we go into that supplements, because I definitely want to go there, is I want all of the physical therapists out there to remember you are still in many ways also a coach. And when you start strengthening this rapport with your clients, when you start digging deeper, especially at a few sessions in, it shows that you care and that you're looking at their things, and you're not just checking boxes. You're like, you're really not improving at the rate you want. Let's go deeper. It's similar to me if I just had my clients come in and gave them a meal plan and was like, all right, bye, see you next week. But if they're not losing weight or they're not seeing improvements in their A1C, and I'm like, as much as I cover sleep, stress, and exercise at their first initial assessment, if I don't circle back to those things and say, hey, are you exercising routinely? Like, are you sleeping? It shows that I'm just I only go by my system. And something that I've loved here at R2P is seeing that beyond just physical therapists, they care. They care about the progression of their patients. So I just wanted to bring that up because I loved what you said. And this integration, I think, between dietitians and physical therapists, I think is something that the industry is going to grow into. So having that, I'm also still a coach mentality, will always serve you well. So in terms of supplements, and this is a wonderful topic because, of course, it comes up a lot more here than it has previously. I think in more of a clinical stance, dietitians tend to be very clinical minded. That's how we're trained. But holistic nutrition is on the up and up. And I actually worked in an apothecary for about 4 months because we really are not trained on some of the ins and outs of supplements outside of the general stuff. So building on that knowledge was important to me. And I am by no means like saying I know every supplement out there, because I swear 10 more come out every single day. But I always want to make the note that supplements should supplement a good diet. They're not meant to be the end-all, be-all. You can't take a fruit and vegetable gummy and not eat fruits and vegetables. So on the general, I think that supplements can be useful. Going just for the very generic, like a multivitamin and mineral, is a great place to start because, even if somebody eats a perfectly well-rounded diet, sometimes you're lacking on a little bit of this or you're lacking on a little bit of that. And a good general multivitamin and mineral fills those gaps in on any given day. So especially with people with increased demands. So elite athletes or even good, strong weekend warriors. That's increased demand. For even youth athletes or anybody in an injury or recovery situation, I think that increased demand is appropriate there. So pretty much your entire population here is in some form of recovery mode. So I do think there is a place for some good general supplementation, but the biggest thing I just want to make sure of is that we don't try and glaze over quality nutrition and just go straight into supplementation. Because some of the supplements that I recommend pretty generally and that are safe for 98% of the individuals out there are never going to replace a quality diet. But I'm definitely not anti-supplement. I just want people to do it with intentionality, know why they're taking their supplements. That's very important to me. And then make sure that they're getting it from a quality manufacturer, especially youth and collegiate athletes that get drug tested. That's an important thing to touch on.
So that's kind of my next question. You had mentioned the multivitamin and supplements in general. They're readily accessible.
Yes.
You can walk into any store. You can walk into a Walmart. You can leave with a handful of supplements. You can walk into a GNC. You can go to online. You can get them from a variety of places. I know one thing that I struggled with when I was in college and high school, and you'd start looking at different supplements is, to my knowledge, they are not FDA regulated, correct?
Correct.
So you had mentioned trying to find a reputable or a quality place to get them. Do you have any recommendations in regards to what are avenues that people can do to either validate that they think they're getting them from a good source, or are there just any personally that you have tended to find yourself gravitating towards either in like the traditional brick and mortar standpoint or the online space? And I guess what I'm really getting at is like, are all multivitamins the same? Like if I walk into a grocery store and I get a generic multivitamin, or I get them from an online platform, how do I know that I'm actually getting something that's quality?
Oof, yeah, we could do an entire podcast on that alone, but I will just say some really good stuff. The brick and mortar locations I think they're phasing out. Like there's even less GNCs out there, which was like huge when I was in high school. But one of the things is to look for third party testing. R2P is partnered with Thorne Labs, and I've always loved that company. I've used them well before I came on because they have a physician-branded board to make sure that what is in their products is legitimate. They do have third-party testing. And there's also an NSF certification that they can get that actually clears and approves them for NCAA players. So that's big because even things like pre-workouts can have, pre-workouts that are not NSF approved, that are from questionable companies, can have things that like amphetamines that are banned with certain NCAA athletes. So I think making sure that the company that it's coming from, like I said, Thorne Labs is very reputable. There are other ones out there, is very, very important. And then to also make sure that you can look on the labeling for third-party testing. So that means it's not just Thorne saying what we have in here is true. We've sent this to a lab. They have verified that what is in this product is in this product. And that way, that's another just level of assurity that your products haven't been really tampered with, and there's not things in there that shouldn't be.
And then a follow-up question. This kind of links back an earlier conversation where we were talking about individuals on a restricted diet, but where combining supplements and potential dietary restriction, a patient population that I always find myself with them initiating the conversation is our post-surgical population. So whether it's an individual who had a total knee or a total hip replacement, and they may be an adult population that's just, they're very regimented in their diet, and they know what they typically consume on a day. They know what their typical general activity level is. Now they've had this big surgery. They're less active, and they don't know what to do from a dietary standpoint. They don't know, if I'm being less active, do I need to consume less? Is that detrimental? Is that beneficial? Same thing with our high school, youth, collegiate population who, maybe they're a college athlete or a high school athlete who trains 5, 6, maybe 7 times a week, at least in some capacity. Now they've had an ACL surgery. They've had a rotator cuff repair. They are more sedentary than what they typically are. And the two conversations typically come up with post-surgical is there something that I can do that would be beneficial from a healing standpoint with supplements? But then the other part of the conversation is, should I be making any changes to my caloric intake or just overall volume of food that I'm eating? And I know I'm putting you on the spot, and this is a very nuanced conversation, but if you had to speak in generalities, with those two topics, how would you approach those, or how would you like that conversation to be steered?
Sure. So with post-surgical, obviously specifically with like soft tissue work, there are some supplements that you can add in that can assist patients. And sometimes, first off, these do actually assist with soft tissue healing and recovery. It's not all placebo effect. But I think sometimes giving people supplements that can boost healing will also give them a sense that they are doing something to help, and that takes some stress off. And we all know that lower stress, better healing and recovery. So some of my top supplements for healing and recovery, none of the first ones would be glutamine. Glutamine is essential to soft tissue repair and healing. So it's also great for the gut. So there's really no benefit and drawback. And because it's just an amino acid, people could literally take the entire container and probably have no ill side effects. So normally with glutamine, I would say anywhere from 5 to 15 grams. Once, you could even go up to twice a day. I mean, you can really load yourself with glutamine. Now, that doesn't mean more is always better, but it's a very safe recommendation for physical therapists to make. That, especially when you combine glutamine with vitamin C, anywhere from 1,000 to 1,500 milligrams a day, which also can aid in anti-inflammation, soft tissue repair. And then sometimes, especially since it's very on trend and people tend to appeal to that, is collagen. Again, you don't have to supplement with this when people are kind of squeamish, and you might just be able to sneak in some glutamine. I always tell people bone broth, especially if you make it from home or buy the stuff that there's a product out there that actually looks like collagenous when you see it, that's the type of bone broth that you want, because that's got a natural source of collagen. Those are some of the best ones for healing. To piggyback on that, with the caloric restriction, it is going to be very individual. I had a high school football athlete in the clinic on Monday, and he had lost 20 pounds, and he was only 4 weeks into recovery, and it was because he was restricting his diet so much because he didn't want to gain too much weight. But I'm like, dude, you're 17, you're a linebacker, like your metabolism is still kicking, you are in recovery. You cannot go into too big of a caloric deficit, or you will slow down your healing. So one of the things that you can speak to if you don't want to speak directly to calories is making sure they are getting adequate protein. And a good supplement for that is any type of whey protein isolate. If they are vegan or vegetarian, they can do a vegan protein powder. I tend to prefer whey, but there's nothing wrong with a vegan protein powder. But saying, well, if you are going to, especially for an older population who may have had a total knee and they are a little bit more prone to weight gain post-surgery, you can say, well, if you want to watch, portion sizes of carbohydrates and fats, that's fine, but do not hold back on protein. That is going to be what preserves muscle mass, keeps your immune system up. Again, if they don't want to supplement with glutamine, it provides glutamine. So if you can really get a lot from a high-quality protein powder, and making sure that is never restricted in a recovery situation.
And I do want to continue down that protein route, because I have a couple questions there, but wrapping up this kind of supplement talk.
Sure.
You had mentioned whey protein as being one. Are there any other supplements that you find yourself commonly recommending for people? And if so, can you just kind of shed a little light on why you find yourself commonly recommending them, and really what they're beneficial for?
Sure. Two of them come to the top of my mind. The first one is creatine. And I wanted to touch on this because I think there's a lot of misconceptions on creatine. It's coming out more that this is just as much of a benefit to muscles and power athletes, and recycling ATP in the muscle so people can train harder for longer, as much as it is a neurological benefit. So this crosses the lifespan. You get 16-year-olds who are looking, how can I build muscle and train harder in the gym? Creatine's perfect for that. But then you get up to your older populations, and they're really showing amazing cognitive protective qualities of creatine in the brain. So this is something that can go all the way from your youngest athletes to your oldest athletes and oldest population in recovery. So 5 milligrams of creatine monohydrate is extremely safe. There's really no ill side effects to it. So that would be number one. And number two would be a high quality omega-3 fish oil. Anywhere from 1,000 to 2,000 milligrams a day. The combination of EPA and DHA, we won't go. There are situations where you'd want more DHA and EPA, but on the general, they're fantastic for anti-inflammation. They have great cardiovascular benefits, and on the DHA side, wonderful benefits for mood, cognition. It's great for prenatal growth and development. So again, really can cross the spectrum. It's also just of the note, the fish oils, the research is still kind of developing, but they do have wonderful places for concussion rehab. So, bringing in an omega-3 fish oil for post-concussion protocol is definitely something that the literature is pretty big on. So those are the two that I find myself really reinforcing on top of the whey protein, glutamine, and then, collagen, vitamin C.
It's interesting. I am now 36, and when I was in high school is kind of when the creatine phase was, and that's where all my friends were taking creatine, and they were getting big, they were getting strong, but it was still in the relatively early phases where we were very confident in the sense we knew what it did from a performance standpoint, but they were still a little bit concerned of, what are the long-term lasting effects of this? Is synthetic creatine supplementation going to have any adverse effects on our own natural production of it? And I've been kind of like a casual observer from the sideline because I never got into it, mainly because I was well aware there was enough just basic things in my own diet I should have probably been worrying about before trying to supplement with creatine. But creatine research has been fascinating to me in the sense of we just keep finding more positive things about it, and to my knowledge, not really much, if any, negative. And you had mentioned there's the physical component, there's the mental component. We're starting to realize that it is now beneficial, like you had mentioned, across a wide variety of populations. I've even seen that they're recommending it like in childhood now, that it can be even beneficial with that. So it's interesting. I'm still kind of that observer from the sidelines soaking it all up, but it's been really cool to watch just that progression of what was a once very performance-heavy supplement to now more of the wide variety of uses that it could be. With respect to protein that we touched on earlier, what are just some common discussion points that you have with your clientele, whether it's just general rule of thumbs in regards to the amount of protein that they should be consuming? Are there certain types that you find yourself leaning towards, whether it's animal-based or vegan-based or supplement? Do you care at all about like the timing as to how they're doing it, if it's just part of their regular diet versus if it's being consumed as a supplement for working out? Could you just touch a little bit on kind of protein and those big discussion points there? Sure.
So in general, I would say every person really, even going down to children, in my opinion, but really let's just stay with our youth athletes up through the general population, they need a source of protein at every single meal. Remember, it's not just muscle and soft tissue. It's also our immune system is 80% protein based. So you could teach an entire graduate level class on the functions of protein. So it's not just muscle. And so it is well within a physical therapist scope of practice to ask their clients, are you getting protein at every meal? And also really focusing on making sure they are getting protein within an hour to 90 minutes of their training. And if their training is in the physical therapy clinic with you, they need to follow up with protein. Because anytime you break muscle down, you've got that window for recovery. So you really want to hammer it in those locations. In terms of volume, it is a little bit person-specific, goal-specific, but the RDA has been shown time and time again to actually be on the lower side, and that's 0.8 grams per kilogram of body weight, of ideal body weight. If you have an overweight or obese client, you don't want to feed that obesity, so that's a very important point. But I'm much more comfortable between a gram and a half per kilo. If somebody is in a weight muscle gain, much higher, closer to a gram per pound of body weight. Again, the only time I would even be cautious with the amount of protein coming in someone's diet would be in an advanced kidney disease, advanced liver disease. So high protein diets are not going to hurt the kidney. They are not going to hurt the liver. There's decades of research now to support that. So again, in my 6 months here at R2P, I've only restricted protein once, and it was in a 95-year-old patient with chronic kidney disease at stage 4. So it's very rare.
And just to put some context to that, you said general guidelines about 1 gram per kilogram of body weight. So
would be like my baseline low.
Yeah. So like for myself, I'm, depending on the day, somewhere around like 215 pounds. So my baseline should be about 100 grams of protein. And then you had said upwards of 1 gram per pound if they're doing the physical activity to support that.
Correct.
So for myself, that would be baseline, 100 grams. If I am very physically active and in more of that muscle building phase, then it could be upwards of 200 grams per day.
Yeah, I normally don't like to see my women less than 100 grams per day because, I mean, you're only getting calories from carbs, fats, and proteins. And so it's typical that we're going to probably restrict carbs or fat depending on my client, depending on their clinical presentation. Protein, I normally don't like to see below 20% of the calories. So it's very rare that I would take any woman below 100 grams, depending on who they are in general terms. And for men, I like them closer to 120, 130 or higher, depending on their goals. So especially in youth, it's extremely important. So the only other thing I just really want to touch on, and I know this is going to ruffle a little bit of feathers, but we want to think about protein quality and how well that protein is metabolized, absorbed, and utilized by the body. And that's something called bioavailability. And we can't underestimate that effect. So the quality animal sources I do promote. So things like, whey protein powder, eggs, and then of course animal sources, chicken, fish, good quality red meat, game meats like elk and venison, and all sorts of poultry, pork. Vegans, vegetarian protein sources like soy is the only complete, meaning contains all essential amino acids, all amino acids. Is the only complete vegetarian protein. Then you get into grains and legume combinations. But they do contain protein. It's just the bioavailability is much lower, so the intake needs to be much higher. So I do prefer animal sources just because of the bioavailability and the other nutritional profiles. But again, I do have a few vegan clients, and we work with what we've got.
Yeah, and I think that's where the experience and the knowledge base and knowing how do you put it all together and look at things from a complete profile and appreciate if we're going to have, for whatever reason, either a pathological limitation or influence or a personal preference, or maybe it's just situational and there's certain things that are going to influence individuals' ability to the amount they can eat or the timing of which they can eat. That's the puzzle that I can't put together, but people like yourself can help navigate that a little bit better. Unrelated, but kind of based off of that, another conversation that I see more and more of is the concept of intermittent fasting. And there's a variety of different ways that you can go with this in regards to the types of intermittent fasting or why people are pursuing it or what the perceived benefits of it are. But just in your experience and with individuals that you have worked with this, what are some of either the benefits that you have seen from individuals who are doing intermittent fasting? And then what are just either some of your concerns or the challenges associated with it as well, just for people who maybe they have not experimented with it and they're considering it, or they've been recommended to try to do with it? What would be just some big take-home messages that you would like to share with the potential benefits, but also the concerns, challenges, or shortcomings that may come with it that people should be aware of?
Sure. So intermittent fasting is definitely not a negative thing when it is situationally appropriate. The way I've used it clinically is to, especially when somebody has pre-diabetes, sometimes being able to limit the eating window allows the body to be in a fasted state for longer. So you see good reductions in blood sugar and in fasting insulin levels, and also sometimes discipline. To not eat after dinner, because we know nothing good comes in after dinner, and delaying breakfast, allowing people to really feel hunger and dissociate hunger and appetite. I find that intermittent fasting is a wonderful tool for that. What I don't recommend is people living in an intermittent fasting state. So when it comes to using this for weight loss, it's hard because I don't want my clients to live like that long term. But it is a fantastic tool for, like I said, improving some specific biomarkers and also allowing clients to really feel the difference in hunger and appetite. Where I would throw caution in would be in any type of situation where calories do matter. Any type of place of growth. This is not appropriate for teenagers. The amount of youth athletes I see skipping breakfast is appalling to me, and it's very, very hard to get in adequate protein for a youth athlete within an 8-hour window. And typically, if they don't eat breakfast, they eat a lunch, and they come home, they're ravenous. They're not going to go for a big piece of salmon. Maybe some people will, but they typically head more towards things that are more carbohydrate and fat-based, and not that that's necessarily bad, but I see what starts falling out is protein. So I really caution it with any type of, I actually do not advise it for any type of youth or collegiate athlete. I don't really advise it for any type of long-term practice, normally between 60, 90 days at the most. And anybody who wants to be in a place of growth, I would advise to get away from that because it is going to be hard to get, the protein intake and some of the nutrition that you need within an 8-hour time window. So that would be some of my pros and cons to it.
And I think I've never experimented with it. I don't have really much experience or knowledge of it at all, just from the concept of what it is. But I liked how you had touched on one of the biggest benefits that people may be getting from it is just the structure and the discipline and just the appreciation of I'm not eating prior to this window. I'm not eating after that window. In theory, we all fast. Like if you sleep, you're fasting,
Absolutely.
Unless you have a irregular schedule where you're kind of up and down at odd hours of the day. But if you have a regular waking and sleeping schedule, you're already fasting to some degree. So if you can provide a little bit of structure as to, and whether it's, an 8, a 12, a 16 hour, whatever that window is, but if you do just get the habit of, like you had mentioned, delineating, do I need to eat or do I want to eat, or is eating providing more nutritional value at this hour, at this time? As with many things, just having that structure and the expectation of when am I going to eat, when am I not expecting to eat, and just having that regularity. I kind of like you mentioned, maybe if you're doing that for a 60 to 90 day window, it does allow you to take those habits into a more, quote unquote, traditional diet moving forward, and just establishing what some of those expectations are. And, personally, I'm somebody who gets up early, and I usually get up sometime around 5 o'clock, but I don't typically eat until 7, not because I'm intentionally holding off on that. I'm not hungry when I wake up. So I think that's something where at the end of the day, I typically go to bed somewhere around 10 o'clock, but I usually don't eat after 8. And it's not intentional. It's just the way that my day is structured and scheduled. That tends to be how it falls. And I could see somebody who's doing intermittent fasting, maybe they're doing like a 12 and a 12 window of eating and non-eating. That would be 7 a.m. or 7 p.m. to 7 a.m., which when you think about it, that's not all that irregular to begin with. And you could very easily fit in your regular meals during that time frame.
Absolutely. That's why I like to delineate between time-restricted eating and intermittent fasting. And time-restricted eating is that 12 and 12. That traditionally, that's what they say. And I think anybody could do that with no ill side effects. But when you start shrinking that window down to like an 8-hour, that's more like where I delineate intermittent fasting. And I think that's more where I would throw caution than like the 12 and 12, I think, is a wonderful practice.
Yeah. It's funny, from a PT standpoint, I always make the analogy of when an individual comes in and they have low back pain or neck pain, and we do an evaluation and we find 5 or 6 different things we can do. Hey, we can do some soft tissue work. We can do mobility. We can do strength. We can give you better awareness to your posture, your positioning, how you're moving and how you're performing activities. We can sleep better. We can just do non-specific exercise. We can go out and walk. There's a lot of literature out there that just shows non-specific exercise is highly beneficial in non-specific back and neck pain. As I've evolved through my career, I've gone through phases where, I do a little bit more stretching with people, or I do a little bit more strengthening, or I'm dry needling. So I do dry needling and soft tissue work. The one common theme that I've found is most of the individuals, assuming you got the diagnosis accurate, they tend to get better. And But the thing that I've found is it's less involved of, am I pushing on the right spot or needling the right spot? Am I giving them the perfect exercise or the perfect stretch? Or is it just the fact that they actually committed to coming in and seeing somebody, developing a plan of care, making an intentional effort, and just being very strategic about it? And that's kind of the realization that I had a few years ago that, maybe all these different, from a PT standpoint, am I a McKenzie practitioner? Am I a soft tissue person? Or am I a just load it and let's just get really strong? In the grand scheme of things, that's probably like the third or fourth thing on the totem pole we really care about, outside of just ruling out red flags, establishing a plan of care, finding benchmarks that we want to track and be consistent with, and then making sure everybody's on the same page with how we're progressing towards that. Oftentimes, that's enough to get the bulk of what you need. Then you can tinker with things. Then we can really start to get into the weeds of like, all right, if we're doing strength training, what type of strength training should we be doing? What type of movement profile are we trying to create for this person? But that's where I think there's a lot of parallels when we talk about the different facets of healthcare, whether it's PT, whether it's personal training, whether it's chiropractic, whether it's nutrition and diet. There's oftentimes you take care of the foundational rocks, and a lot of the other stuff becomes, like icing on the cake at that point.
I could not agree more with nutrition. It's so easy with social media and getting all these influencing factors that people get lost in the weeds. And they just forget that being very intentional. I love that word, being intentional with your diet, making sure the protein is there, making sure the vegetables are there, making sure you're watching your portion sizes, and making sure that the extras are minimal is a fantastic place to start. And you don't have to label yourself vegan, keto, fasting. Just on the general, if you're doing well and right, 80% of the time you're going to be okay. When other, things like clinical or injury or all these other external factors, performance come in, then we can get into very specifics. But no, I agree completely that on the general, what matters most is just being intentional with your nutrition. And I think that physical therapists are wonderful practitioners to speak that to their clients. Are you even just being intentional with your diet? What does that look like for you? And all of a sudden the conversation evolves. And from there you can either check that box, this patient is great, their nutrition is good, or maybe I need to continue this, keeping it in the back of your head, I need to continue this conversation and possibly refer out, if something doesn't change or progress.
Cool. Well, Jess, thank you for taking the time out of the day today. I enjoyed the conversation. I'm hoping people listening got a lot of big take-home messages as well. If people do have any further questions, or they just want to get in touch with you or follow along for more educational information, what is the best way for people to get in touch with you?
Well, we do have a wonderful web page at rehabtoperform.com/nutrition. On social media, there's two main avenues. I am on Instagram at J_Murgeytio_RD, which you can, I'm sure, put somewhere because the last name is challenging.
We'll put it in the link.
Yeah. Perfect. And then on Facebook, I just started my own page called Nutrition for Optimal Aging. And I try and post there every day and just provide another place for information. So yeah, any one of those platforms, reach out if I can ever be of assistance.
Awesome. Well, Jess, thank you for your time. For everybody listening in, have a great day and stay tuned for our next episode. And we will have Jess back on with us in the future as well.
Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcast or Spotify. Until next time, thanks for listening.